Okay, good evening, everyone. Looks like we can go ahead and get started with our presentation tonight. And I am Amanda Bodel with My Horse University and just want to get us started off. So welcome to the My Horse University and Extension's Horse Quest live webcast titled Gastric Ulcers, How to Tell If Your Horse Has One and What to Do If It Does. Our presenter tonight is Dr. Jenifer Nadeau. Jenifer is an associate professor and equine extension specialist for the University of Connecticut, where she's been since 2001. Jenifer grew up riding and working with horses, including a variety of breeds and disciplines, such as trail, hunter-jumper, draft, and race horses. She also rides both English and Western. Her research focuses on equine health, while she also teaches animal nutrition for undergraduate students and works in extension outreach with adult horse owners and 4-H horse project members. Most of you have already seen that you can use the text chat to the left of your screen to ask questions, and we'll be trying to answer those throughout and also compiling them and answering them at the end. And our presentation tonight will be recorded and uploaded to the My Horse University website by the end of the week if you would like to review it at a later date. And at this time, I'll turn the presentation over.
Hello everyone. Please let me know if I go too fast. Sometimes I can talk a little bit fast, especially with this subject because I've given a lot of talks on it. So do slow me down. I always tell my students I'm like a runaway train and they just have to rein me in. So they go ahead and do that. So tonight we're going to talk about equine gastric ulcer syndrome, and you'll also hear it called EGUS, kind of a buzzword in a short way. We're always looking for a short way to say things in our world. So basically about 60 to 93% of performance horses have had this problem, which may be why some of you are on tonight. 40 to 58% of show horses. It's found in as many as 25 to 50% of foals, but a study that we did here at UConn, we did find that only 11% of lesson horses had it, so maybe that's a little reassuring to some people. And we thought that one of the reasons that that study might be a little lower was that the horses had a lot of turnout on that study, and we felt like that might be a reason that they may have had less ulcers. So toward the end of the presentation, we're going to talk about some ways to prevent ulcers, and that's definitely going to come up, the management of the horse. It's a very important way that we can help to prevent ulcers. Also, we find that it's about 66% in pregnant broodmares and 75.9% in non-pregnant broodmares. Those are only a couple of studies that have shown that, and they think that diet may have played a role in that perhaps their diet not being a lot of forage may have resulted in them having more ulcers because they were on a fairly high grain diet. And then about 37 to 53% of pleasure horses, which is a fairly new thing that we've found. So that kind of gives you an idea of how many horses are likely to be affected and whether your horse falls into one of these categories, which may put it more at risk. So let's just talk a little bit about the stomach anatomy. And I just wanted to talk to you about some different regions of the stomach. And this region here is what we call the non-glandular region. You'll also hear it called the squamous epithelium. That's this tissue here that lines this region. It's called the squamous epithelium, and epithelium is like a lining of a membrane. And then we have here the greater curvature, and we find a lot of ulcers along this greater curvature region. And this is what we call the margo plicatus, this dividing line between the non-glandular or squamous epithelium and the glandular region. So the glandular region is the region that actually secretes. There are no glands present in the stratified squamous region. It has minimal protective mechanisms, therefore, and really doesn't play a functional role in the stomach, but it is a place where a lot of ulcers occur. We can see that this area here is where the esophagus comes into the squamous region. And then here is our margo plicatus, or dividing line, where, like I said, we do find a lot of ulcers. And this is our glandular region, where we have a lot of hydrochloric acid secretion, and we also have a bicarbonate and mucus layer. Horses are actually continuous acid secretors, so they're always secreting acid. The squamous region tends to be about 5 to 7 in the pH, so that's a little bit higher, less acidic, while the glandular region is usually around 2 to 4. But again, that can vary quite a bit between horses. Some horses are more acid secretors than others. Gastric juice itself is usually a pH of about 1 to 2. And in the stomach, there are liquid contents, and these decrease in volume by half about every 30 minutes. And solids decrease about every 1.5 hours by half. This is, again, the pyloric region, still part of the glandular region, and then it goes out to the duodenum or the small intestine. Also in the stomach, we found some bacteria to be present, which includes the lactobacillus bacteria, streptococcus, E. coli, and helicobacter. Helicobacter has been implicated in ulcers in humans, so we have found that. Okay, let's just talk a little bit about the types of ulcers that can occur in your horse. The first type that we have is called primary squamous ulceration. And this occurs when there's an increased acid exposure, usually due to an alteration in the pH gradient. There is a content stratification in the stomach, so we'll have different layers, like the grain layer on top, then the hay layer, and so on and so forth. And as I said, the acid is continuously secreted. So if we don't have a lot of meals going on, like infrequent meals or a long delay between meals, more acid will be exposed because the stomach will empty, and then it will be exposed to a lower pH. And this is the way that primary squamous ulceration usually occurs. With primary glandular ulceration, acid exposure will occur due to a failure of the mucosal defenses. So usually we talked about how the glandular layer will secrete mucus as one of the things, and bicarbonate, which are kind of protective. But in this case, those mucosal defenses fail, and then the horse ends up being exposed to this acid. So it does not act as a buffer, and the horses are exposed to the acid. The other type of ulcer we have that can occur in horses is secondary squamous ulceration, which is usually due to a pyloric disease. So there's some problem with that pyloric area, which we saw, and this results in delayed gastric emptying. So the stomach will not empty, and this will increase the residual gastric fluid volume. So the fluid that is present in the stomach will then build up, and we will get dorsal movement of the acid. Okay, someone asked for us to define ulcer, and I'm going to show you on the very next slide what an ulcer is. So if you look on this slide, you can see this is a nice, clean stomach. The epithelium is intact, and we have no signs of hyperemia or hyperkeratosis. So this is what a nice, clean stomach looks like. On this layer, we can see that we have these little tiny ulcers here. We have the, actually, here's an area with hyperemia or hyperkeratosis. I didn't show you a clean stomach. This one is a clean stomach right here, 0. And here, the epithelium is intact, but we do have this little area of hyperemia or hyperkeratosis. This one, we have some pictures of small, single multifocal lesions. So you see these little guys right here. I'll get my green pointer out again. This is an example of a lesion or an ulcer. So you'll hear lesion and ulcer kind of used interchangeably by people. Okay, then when we look at this region, that was a grade 2 ulcer. Back here we have a grade 1. These are both grade 2. So you can have more than one example of that. And then with grade 3, we have large single or multifocal lesions. See how many lesions we have showing up here? And these, or we have extensive superficial lesions in this case. So these are all ulcers that we see here. And then with a grade 4, from the this grading system comes from the Equine Gastric Ulcer Syndrome Council. My major advisor, Dr. Frank Andrews, who's now at Louisiana State University, with others helped develop this system. And we can look here and we see a grade 4 ulcer. You see these extensive lesions, and we have deep ulceration. You can see how it's going deep in the tissues here. See that? Okay. So those are our squamous ulcers. Now let's go on and look at our glandular ulcers to see what the difference is between an ulcer in the squamous region and an ulcer in the glandular region. So here we see this epithelium. The mucosa is intact. This is a glandular mucosa, so it's going to have a different appearance, more of a red appearance because it does secrete, so it has a reddish appearance. But again, we have areas of what we call hyperemia, so you can see that here. Okay, now when we look at this, you can see these small single or multifocal lesions. So that's a grade 2. And then when we look at grade 3, we have some large single or multifocal lesions or some extensive superficial lesions like we see here. And then going to grade 4, we have extensive lesions with areas of apparent deep ulceration or mucosal pathology. So something wrong with that mucosa, some pathologic disease going on. So we see that with these. Okay, and again, this system too, this is all part of the EGUS, Equine Gastric Ulcer Syndrome Council. They actually developed a council of veterinarians that came up with this particular system. Okay, now we're going to talk about the causes of ulceration. The first one we have is diet, especially the presence of hydrochloric acid, which we know helps to lower pH, and volatile fatty acids. So basically what happens in this case is that we get a permeability to hydrogen ions. So a lot of times this will happen. For example, if a horse is fed a high starch meal, we might get a decrease in gastric pH. So that's one thing that we could see. So I myself have done a lot of studies in this area. Basically what we found is that when carbohydrates are fermented by the microflora within the gastrointestinal tract, volatile fatty acids are produced, and these are normally weak acids. They include acids like acetic acid, butyric acid, propionic acid, and valeric acid. But at a low pH, there's a decrease in the mucosal barrier function in that non-glandular region of the stomach, and these VFAs have a lipid solubility. They're lipid soluble or can penetrate that membrane at a pH less than 4. So the VFAs actually penetrate the cells in the non-glandular gastric mucosa, and that acidifies the cell contents. It inhibits sodium transport, which is the normal thing that would occur in the cell, and it does cause cellular swelling. So some other researchers, Andrews et al., have found that squamous mucosal cells are susceptible to this VFA injury in a pH, dose, and time-dependent manner. In other words, they have increased injury with a lower pH. The higher the dose of the volatile fatty acid, the greater the damage, and the longer the tissue is exposed, the greater the damage. Then we have bile acids, and the backflow of duodenal contents is a normal occurrence in horses. They always get kind of like an acid reflux, as we would call it. And we think some research suggests that reflux bile salts may cause gastric ulceration through an increase in non-glandular mucosal cell permeability to hydrogen ions. So basically, that means that the non-glandular mucosa is able to take up hydrogen ions when this bile reflux occurs. There's some researchers that feel that this is questionable because they feel that bile salts, that a less acidic duodenal reflux is occurring. So they feel like that would be non-ulcerogenic. So that is, bile acids are a place where people can't really agree on what's going on with that. Bacterial contamination, including Helicobacter pylori, as we said in humans, that has definitely been found to be a causative agent of ulcers. But we really have no conclusive evidence of this in the horse. Although there was a study in which there was a necropsy, so that's kind of like an autopsy in humans. We call it necropsy when it's on animals. 20 thoroughbreds were examined for the presence of Helicobacter DNA to see if they had Helicobacter present in their stomach, and 2 out of 7 horses with ulcers, 4 out of 5 horses that had an inflammation of the stomach, and 5 out of 6 horses with both actually had Helicobacter DNA present. So that's kind of interesting. There was 1 out of 2 horses that had normal mucosa that also had Helicobacter DNA present. And no one else has really found evidence of Helicobacter being a problem in horses. And people do want to study that more, although there aren't any studies going on that I know of as of right now. And other bacteria have been implicated in preventing ulcer healing in the presence of ulcers, like E. coli, which happened in rats. It impaired healing, and lactobacillus in another species. But again, we don't really know too much about exactly how that may be occurring. And then when we look at non-steroidal anti-inflammatory drugs, you hear about those inducing ulcers in the horse. And this occurs primarily in the glandular mucosa. Here we're thinking of things like phenylbutazone and flunixin megalamine, which you may know as Banamine. And really they feel that the way that this works is it may be due to the effect of prostaglandin inhibition. So these drugs are inhibiting prostaglandin from being released. So that results in reduced mucosal blood flow. So there's no blood flow going to the mucosa, so therefore there's decreased mucus production and increased hydrochloric acid secretion. So normally adequate blood flow would remove hydrogen ions that would diffuse through the mucosal layer that covers the glandular mucosa, but in this case that blood flow is not occurring, so that may lead to a hypoxia-induced lack of oxygen, cellular acidosis. So the cells turn acidic. They release oxygen-free radicals, phospholipase, and proteases, and these may damage the cell membrane, and that will lead to necrosis or death of the cells, and that results in an ulcer. Another thing that they've found as being a problem in horses is intense exercise in horses. They feel that this causes gastric compression, and acid contents are then moved into the proximal squamous line region of the stomach that we saw, and with exercise, and this is called acid splashing, and this may also occur from gastric reflux. They also found that gastric pH decreased rapidly to less than 4 at the beginning of walking, continued to decrease during trotting and galloping, and remain low until the horses return to a walk. So that's kind of interesting. The more that they exercise, the more the gastric pH decreases. So as we could think about then, horses in intensive training programs are then exposed to a longer daily duration of exercise, so therefore we'll get an increased duration of acid exposure, and this could lead to acid ulceration. Let's see, someone asked if it's true that a horse sheds its stomach lining every other day, so giving a bute on an every other day schedule is okay. I'm not sure exactly how long it takes for a horse to shed its stomach lining. I don't think that it's that frequent, but I do know that continuous exposure to bute will still cause this problem. So it's when you go for a long-term program, we would have to check with one of our veterinarians to see if they're recommending an every other day schedule. But as far as I know, most people are recommending that you try to avoid non-steroidals as much as possible, except for when they're absolutely necessary. And if you do have to give them on a regular basis, that you consider giving something like omeprazole or Gastrogard to act as a buffer so that you can help to prevent ulceration from occurring. And we're going to talk more about that later on. Okay. Next is our causes of equine gastric ulcer syndrome. So we talked about this a little already. The damage occurs when aggressive factors overpower the defenses of the gastric mucosa, as we talked about. We said that squamous mucosal lesions, about 80%, actually result from increased acids, and glandular mucosal lesions, or 20%, result from impaired mucosal protection. So those are the reasons that we get equine gastric ulcer syndrome. I just want to share with you some of my research, which is kind of what led me down the path of working with gastric ulceration. As I said, my major professor was Dr. Frank Andrews, and he did a lot of studies with Marielle and the people that made Gastrogard in the early days of it. And we did a lot of ulcer studies, and I was interested in looking at nutrition and how it related to the horse. So we decided to put the horses on 2 different diets. We had some cannulated mares, which was actually the reason that I ended up going to the university. We had about 7 of them, and he brought me in and he said, you know, if you're not able to do the study, these horses, we may not be able to keep them anymore. And I was like horrified, so I was like, oh no, I definitely have to go there. So we did a study, and we put these horses, we could collect gastric juice from their stomach. So we thought, well, let's try 2 different diets and see how that affects them. So we put them on an alfalfa grain diet, and I have to tell you the truth, originally I thought that the alfalfa grain diet was going to be ulcerogenic because it had grain in it, and I thought, well, that's a highly fermentable carbohydrate, so that they're probably going to get an decrease in pH in their stomach, and they're probably going to get more ulcers. And then we put a brome grass hay diet as the other diet, because I thought, well, that's as mild as you can get, and we'd feed a lot of maintenance horses that, and they'll probably get less ulcers. But as you can see, we had an increase in ulceration when we fed the brome grass hay diet. So you can see here that we had more lesion numbers when we fed the brome grass hay diet than we did with the alfalfa grain diet. And another thing we found was that the ulcers were more severe on the brome grass hay diet than the alfalfa grain diet. So that was kind of interesting because, we had no change in glandular lesions at all, which I guess would make sense after what we've learned today, that those really, aren't impacted by diet. But this was funny. So we were like, well, why did this happen? Why didn't the alfalfa grain diet produce more ulcers? And the only thing that we could come up with was that it must be that alfalfa acted as a buffer because it does have high protein and high calcium. And so we felt that that buffered the pH and helped prevent ulcers. And actually, just recently, I was reading through some literature, and I saw that someone had repeated my study, which I think that's like a nice compliment. When you see someone repeat your study, you're like, wow, they're really wondering if my study was authentic. And it turned out that they confirmed my study, that alfalfa did help prevent ulcers in this study of horses that they conducted. So I felt really good about that. I was like, good, my study wasn't just something that happened once. It's truly, alfalfa does act as a buffer and helps to raise the pH of the stomach and prevent ulcers. So that's kind of interesting. Okay, this is another study that I did. So, well, this is part of that the study in a way, because when we did it, we found that certain volatile fatty acids, acetic acid, propionic and butyric acid especially, help to that their presence was an increased risk factor for gastric ulceration. And the way we think this is happening is that VFAs with a high lipid solubility and an ability to remain undissociated at a low pH leads to cell acidification and damage to sodium transport, leading to cell swelling and necrosis and ulceration. And how do we find this out? Well, we did another study for my doctoral degree in which we took gastric tissue from horses that had unfortunately had passed away, and we got it as soon as they were deceased, and we put it into something called an Using's chamber, where we can put physiological pHs into the bubble it through a chamber with oxygen and keep the tissue alive for many hours. And we subjected it to different levels of volatile fatty acids. And we found that this happened, that they had a high lipid solubility, they were able to remain undissociated, and they did cause cell acidification when we looked at it on histology, and cell swelling and necrosis and ulceration. So that was pretty interesting to find that that was true. Okay, so now you're probably wondering, how am I going to know if my horse is at risk for gastric ulceration? So the way that we can talk about some different risk factors that different researchers have found to be risk factors for gastric ulceration. So the first one is age. Some studies have shown that risk was highest in younger horses. My grad student, for example, found that the risk was higher in horses aged 2 to 6 years. So maybe the stress of training is stressing them. But some other studies showed that the risk of ulcers increased by age. These were racehorses in training, so they really reflected only a particular age range and use of horses. The study where they increased by age, whereas our study was young horses all the way through about 20-year-olds. So that's kind of interesting to, really I guess the jury's kind of still out on that. And then also, there's really nothing specific about breed. We did look at that in our study, and we found no breed differences. And we did find that mares had more ulcers. And then a study performed on leisure horses really showed no association between age and risk of EGUS. So really age, that in that study wasn't conclusive. So again, the jury's kind of out on age and whether that's a factor. And as far as breed and sex go, that study also found no association between that. So I think really people, we can't say that Arabians are more prone or this horse is more prone. No one really knows that right now. So the jury's still out on age, breed, and gender, but I bring it up because it comes up in a lot of studies and people wonder about that. Okay, next is exercise. And this has definitely been shown to be one of the most important risk factors. One study showed that horses in light to heavy training for as short as 8 days may be at risk of developing gastric ulcers. And a study in Australia suggested that prevalence in racehorses increased 1.7 times for every week of training. So that's definitely happening. And in an earlier study, horses running on a high-speed treadmill had increased abdominal pressure and decreased stomach volume. And this is where they got the idea of the acid splashing hypothesis. But again, with pleasure and leisure horses in Denmark, there was no apparent effective workload on the risk of EGUS, although none of these horses were race horses. And even if they were used for equestrian training and competition, including dressage or show jumping, the level of workload was less than that of a typical racehorse. So it may be that only strenuous exercise results in acid injury of the non-glandular mucosa. But at least in this particular study, an alternative explanation could be the association between workload and starch intake, since racehorses typically receive increased amounts of starch in association with an increased workload. But competition horses in the Danish study tended to be fed more meals but less starch because they use high quality forage and prepared commercial feeds that typically had less starch than the cheaper straight grains fed to those animals not in work. So the thing about that is really to take home is that all types of work don't necessarily increase the risk of gastric ulcers, but heavy training may put a horse more at risk for ulcers. Okay, next we have fasting. And when feed is withheld from horses before racing or due to the feeding regimen, gastric pH will drop rapidly, and the non-glandular mucosa is definitely exposed to an acid environment. Another thing is that some researchers have used intermittent feeding, like feeding horses on and off a feed-fast model, and those can cause and increase the severity of gastric ulcers. So they'll alternate 24-hour periods of feed deprivation and then ad libitum access to hay for a total of 96 hours of feed deprivation, and this results in ulcers in these studies. This is mainly thought to be due to the lack of mucosal protective factors in this case. Okay, the next one is pasture turnout. Grazing horses in general do appear to have a decreased prevalence of equine gastric ulcer syndrome. Due to a continuous flow of saliva and ingesta, the stomach acid is then buffered when the horse is continuously grazing, and it'll have a pH greater than or equal to 4 or more for a large portion of the day. So that's why we think that grazing is so beneficial. In thoroughbred races and training, horses with access to some turnout were actually less likely to have ulceration, and this risk was actually even lower if they were turned out with other horses. Pasture turnout is actually considered to be advantageous in many reviews, but there was one study of 62 broodmares, 33 pregnant and 29 non-pregnant, that were kept under similar management on pasture, although no details of the feeding program were given. And there was a relatively high prevalence of about 67% in the pregnant mares and about 76% in the non-pregnant mares. So we think that it may be possible that dietary management may be involved in this study. We haven't really been able to deduce this. This was a study in Japan, and unfortunately we've been unable to communicate with them. Additionally, there was no effect on intragastric pH of horses that were housed in a grass paddock, a stall on their own, or in a stall with an adjacent companion when they were fed ad libitum grass, hay, and grain twice a day. So that had no effect. So housing may not affect gastric pH, and being in a paddock itself may not provide any benefit. It may be that the actual eating of the grass is what provides a benefit. And another thing is that with that study, there's really no information on the amount of starch given to each horse per day, because as we talked about, a high intake of starch enhances the influence of low pH by reducing that mucosal integrity in the squamous mucosal. So that brings us to starch intake. And as I was saying in my study, we had thought that grain would be a problem, and starch and grain intake has been associated with an increased risk of equine gastric ulcer syndrome in animals working at various levels of intensity. In 2005, a study found that there was a marked increase in ulceration when non-exercising animals were stabled and fed grain at 1% of body weight, about 3.7 to 5.1 kilograms of grain per horse per day, 1 hour before hay was fed, which is another reason we like you to feed the hay before the grain. And this diet was designed to provide 1.5 times the digestible energy requirement for maintenance. So, in this study, exceeding 2 grams per kilogram of body weight of starch intake per day was associated with an approximately twofold increase in the likelihood of gastric ulcers. So, severity grade greater than or equal to 2 out of 5. And feeding more than 1 gram per kilogram of body weight of starch per meal was associated with a 2.6 times increase in the likelihood of a gastric ulcer score greater than or equal to 2 in the non-glandular part of the stomach. So starch, in this case, was independent of workload, and increased level of work was not associated with increased risk. So it was felt that the influence of starch on gastric ulcers was significant. So we'll find more starch in things like grains, and also in our pastures sometimes. Our starches and sugars will be high at the beginning of the season with our pastures when they're rich and lush. And that will have an effect greatest on the non-glandular mucosa. So again, this is the penetration of those volatile fatty acids produced by the gastric bacterial fermentation of starch, and this results in decreased mucosal barrier function. So feeding a lot of starch can definitely be a problem. So that's why we want to always maximize forage in the horse's diet. If you think about how a horse evolved in the wild horses were always grazing and moving from place to place. So as much as we can simulate that natural environment that they had, that's what their stomach was evolved to handle. And as much as we could do that, that's what's going to work out the best for our horses. Another study found that there was development of ulcers in all horses within 14 days of their removal from pasture, stabling with 6 kilograms of concentrate feed per day, and entering a simulated training regimen. And there was another study where dams were supplied with concentrate feed and foals were allowed to eat their dam's feed. And when more concentrate was fed to the mares, lesions in the squamous mucosa were more prevalent and more severe in those foals. Another study found that small, low-starch meals empty from the stomach significantly faster than large, high-starch meals. So that may be another reason that this ulceration is occurring, because we're getting emptying, and then the stomach is empty, and these volatile fatty acids are then able to penetrate. So on a percentage basis, low-starch meals emptied significantly faster than higher-starch meals, and large, high-starch meals emptied the slowest. But when we compare meals of unequal size, large high-starch meals emptied significantly faster. So meal size as well as composition may actually affect gastric emptying. And then when we think about it also, cereals tend to be low in calcium and possibly other potential buffering agents. So this may also increase the risk of ulceration. So looking at forage feeding now and type of forage, when fed hay and pasture, horses produced about 400 to 480 grams of saliva per 100 grams of dry matter consumed, versus when a concentrate is fed, they produce about half of that, 206 grams of saliva per 100 grams of dry matter consumed. And we know that forage consumption, if you think about trying to eat hay, it does stimulate saliva production. So saliva produced in sufficient quantities will contribute to buffering gastric acid, and it will actually help to coat the squamous mucosal tissue. And without this, damage may occur and ulcers may develop. So we feel that free access to fibrous feed like grass or digestible forage or frequent forage feeding may actually reduce the risk of gastric ulceration. So that's another risk factor, would not be feeding that. So feeding less forage. Feeding alfalfa, hay, and grain results in higher gastric pH and less peptic injury to the gastric squamous mucosa than feeding brome grass hay or coastal Bermuda hay with no grain. That was that repeated study I was telling you about. So forage type may also be important. Actually, straw may provide low levels of buffering support because it has low protein and calcium, and it may result in mucosal irritation. So we don't recommend feeding straw or bedding with straw if horses are not going to be fed sufficient forage that they'll begin eating the straw. Also, time between forage meals greater than 6 hours compared with more frequent forage feeding with intervals less than 6 hours also increase the likelihood of non-glandular ulcers. So you really want to keep time between forage less, because as you increase that time between forage, you're taking a risk of more gastric ulcers from occurring. And then water intake. I remember visiting a farm in the summer. I was looking at it for an environmental awareness program that I was doing. And I asked the guy, do you have trouble getting them to come in from the pasture? He was like, oh, I find it very easy to catch them because I don't give them any water during the day. And I was like, oh no. So providing water continuously, especially in a pasture situation, and really any situation, can also help reduce the risk of EGUS or equine gastric ulcer syndrome in horses. Horses without access to water in their paddock were more likely to have equine gastric ulcer syndrome greater than or equal to 2. So horses really need to have water provided. So we really have to make sure that they have water intake, because this may result in dilution of gastric fluid and increased pH and help prevent ulcers. So horses without water provided have more than 2.5 times the risk of getting gastric ulcers. Okay, someone heard that you should feed about a half pound of grass hay before taking a horse out for training to help keep the pH of the stomach more natural during training exercise. Okay, I would say to you, we're going to talk about recommendations at the end, but you know, really what we're saying is, like, before exercise, you know, you don't want to feed a big grain meal, and you can continue to give them hay. But like if they're going to be racing or something like that, you don't want to give too much feed. So we say to give forage up to about 3 hours prior to a heavy workout or race. So if it's going to be, you know, a heavy workout or a race, then we want to wait and don't give it within 3 hours of the workout or race. But after that, you can again offer forage, and then don't feed concentrates until at least 2 hours after exercise. Okay, I hope that helps. Okay, next is our non-steroidal anti-inflammatory drugs and their idea of the risk factor. Okay, so we did find that after basically there's been an association between gastric ulcer, well, basically non-steroidal drugs have long been implicated in causing gastric ulcers in horses, but evidence of an association between gastric ulceration and administration is kind of lacking in the literature. One thing that they found was there was a difference in blood protein, albumin, and globulin, which is part of the immune system, between control horses and horses treated with phenylbutazone alone. Basically, after treatment with phenylbutazone alone, 3 of 4 horses had no non-glandular ulceration, while 1 of the horses had a non-glandular ulcer score of grade 2 out of 4. When they were treated with phenylbutazone and flunixin-megalamine, 2 horses had a non-glandular ulcer score of grade 2 out of 4. 1 had a non-glandular ulcer score of 3 out of 4, and the horse that had a non-glandular ulcer score of 2 after treatment with phenylbutazone alone had a non-glandular ulcer score of grade 4 out of 4. So this indicates that using a combination non-steroidal to treat horses should be approached with caution, because this may result in negative effects. We know that horses have individual responses and variability in what is an acceptable strength and length of time to be on a traditional non-steroidal treatment. Horses that are at risk of developing ulcers, either with a clinical symptoms already showing or a previous history of ulcer disease, should receive prophylactic administration of anti-ulcer medication, so preventative administration. Or you could use the new COX-1 sparing non-steroidal drugs like fibrexicab, and those are less toxic to the equine gastrointestinal tract compared to the more non-selective non-steroidals like phenylbutazone. So it really varies on whether or not non-steroidals affect the horse. I mean, for sure, a combination has caused ulcers, and people always say that it does, but there is individual variability. So your veterinarian should always be consulted about that. Okay, let's talk about some clinical signs now that we can find with ulcers. So how do I know if my horse has an ulcer? One would be acute and recurrent colic. So we know that colic is really any type of abdominal pain. The horse will look at its sides, may paw, it may kick at its side. It will appear to be in discomfort. And so cases of acute where it suddenly occurs, or recurrent where the horse keeps on having colic, this can be the sign of a gastric ulcer. Another would be a poor body condition. So I don't know if you're familiar with body condition scoring. If you're not, you might want to check out our website, extension.org/horses. That tells you how to do body condition scoring, and that will help you figure out what a good body condition score would be. About 5. The scale is 1 to 9. 1 would be very poor. And 9 would be, the horse is extremely overweight. So you might want to get familiar with that system so that you could use that on a monthly basis to body condition score your horse, and then you will know when your horse is in poor body condition. Another would be poor appetite. Horses are usually very good eaters, so when they are not eating well, that is usually a sign that something is wrong. Also a variable appetite, like one day eating well, another day not, or slowed eating, that can be another sign. We also may see weight loss or the inability to maintain or gain condition. And that's another sign. Poor grinding of teeth is another sign, and a very common gastric ulcer sign. So the horse will keep on grinding its teeth. Some other signs that we can see, kind of more less specific, I guess, would be poor performance, and then attitude changes. So your sweet-natured horse suddenly becomes evil when you go to tack it up. So that could be another sign that, besides saddle pain, that the horse is experiencing an ulcer. Or just in general, its general outlook has changed to a not as good attitude as it had before. Diarrhea can be another sign. So can stretching to urinate. And dorsal recumbency in foals. That's when they lay on their back with their feet in the air. So that's dorsal recumbency. So those are all signs of a gastric ulcer. So the true way to make a diagnosis is really to do what we call an endoscopy. So in the endoscopy, you'll see this tube up here that we can see, and this is an endoscope. And we'll put this tube down through the horse's nostril, and it will go down through their trachea and into their stomach. And on our way down, we can look at the trachea, see if there's anything abnormal, look at the larynx and the arytenoid cartilages. The horse will be under sedation during this, but it will be standing. You can also do a recumbent. A horse can lay down while you're doing it, but it's a little more difficult a lot of times to see inside the stomach when you do this. And you do need to fast the horse for at least 12 hours in order to get a good visualization of the stomach. And down here we can see a picture of what we would see. We'd have like a little TV screen. This is the tube here going through into the stomach, and this is part of the stomach that we can see here. So that will help us we'll look along the margo plicatus, greater and lesser curvature, all along the squamous and the glandular epithelium. We can go all the way to the pylorus and the esophagus, and we can visualize the stomach. Okay, so now let's talk a little bit about medical management of gastric ulcers. So one would be antacids. So a lot of people want to use antacids much like they would take a Tums because they have an upset stomach. So in horses, antacids that are commonly used would include aluminum hydroxide and magnesium hydroxide. These have a moderate effect. They're kind of short-lived. They have a very short-lived effect on pH. It usually only lasts for about 3 hours at the maximum. So that's kind of the problem with using antacids as medical management. So that's one reason that we don't really recommend them, because you would have to give them so frequently that it really wouldn't be effective. Okay. Next we have histamine type 2 receptor antagonists. Some examples of these are cimetidine and ranitidine. And basically in the horse's stomach, a histamine receptor is part of what acts to release gastric acid. And what these receptor antagonists do is bind to that receptor and prevent gastric acid from being released. So these really have poor bioavailability after oral administration. Now what that means is that the body's really not able to use it after it's given orally. So it has to be given about every 6 to 8 hours. And it does have a poor ability found in studies to produce ulcer healing. So that is one of the problems problems with using histamine type 2 receptor antagonists. They can still be used in combination with some other things sometimes. And then we have omeprazole or Gastrogard. And this has been shown to be an effective treatment for gastric ulcer syndrome, and usually at a dose of 4 milligrams per kilogram orally once daily. And usually treatment for about 28 days results in a 92% improvement and about 78% healing. So that's really pretty good. And we can use a lower dose, about 2 milligrams per kilogram, every 24 hours to prevent recurrence. So that is something happens. Basically what happens with our omeprazole is it is a proton pump inhibitor. So it binds irreversibly to the parietal cell H plus K plus ATPase, which is a proton pump. So it basically keeps hydrochloric acid from being secreted, and it can block acid secretion for about 24 hours in horses. And you want to make sure that you're using an equine-specific pH stable form of omeprazole, since use of the human form has poor bioavailability. Only about 16% is available to the horse. And the duration of acid suppression of the human form is only about 12 hours versus 24. So that's not too good. You also have to be careful about buying some compounded products. There was one study that showed that compounded omeprazole was not effective. You can get a generic, I'm not sure about generic omeprazole being available right now. I don't think that it is, but you could always check with your veterinarian to see about that. I believe it might still be under its preliminary stage where it's not available as a generic, but you could check about that. As far as our coating or binding agents, we have sucralfate and bismuth subsalicate. Can talk today. Basically what these do is they bind to the stomach ulcers and promote healing. Used alone, they're not really effective, but they may promote healing if they're used in combination with omeprazole, especially for glandular ulcers. And sucralfate is basically a hydroxyl aluminum salt of sucrose octasulfate, and it binds to the negatively charged particles in the ulcer bed and helps to buffer hydrochloric acid by increasing bicarbonate secretion and stimulating prostaglandin production. It usually, used in combination with other drugs, it's effective for about 8 to 12 hours. And bismuth has a coating effect similar to sucralfate, and it will inhibit or reduce the activation of pepsin. In humans, it's actually used as part of the therapy of Helicobacter pylori-induced ulcers. So we can see that various feed supplements to treat or prevent gastric ulcers are available, but only a few have been tested in controlled clinical studies. And a study of a pectin-lecithin complex called ProNutrient on gastric ulcer healing during an 11-day period in 2 12-horse groups showed a significant reduction in gastric mucosal lesions. So that could have a beneficial effect on the healing of gastric ulcers. So that's called ProNutrient. Okay, now we will go on to our prevention and management segment. And one of our persons said that they had seen their horse have a positive difference in attitude and performance when they changed to a low-starch diet feed. But they had him endoscoped for ulcers and he was clean. So they were wondering if it was lucky or just good management in general for this horse with a high-performance sport. And, you know, it's hard to say whether that was just lucky or, but it really is just good management in general to have, to feed as low a starch feed as you can and still give the horse sufficient energy that it needs to perform as it can. So again, as much as we can mimic the horse's natural diet, feeding the highest amount of forage that we can, but still making sure we meet the energy demands. And maybe now that is by feeding more fat, because fat has actually been found to be beneficial and has not cause ulcers, although it's not less ulcerogenic. There was one study that looked at that and did not find fat to be less ulcerogenic, but there haven't been a lot of studies on fat preventing ulcers, so we don't really know. Jury's still kind of out on that. But definitely feeding a lower starch feed if you can, and feeding more forage would be a good practice as much as you can. But again, you don't want to skimp on energy so that your horse ends up losing condition. So that's why we do want to keep up with body condition scoring so that we can make sure that our horse is maintaining the condition that it needs to be healthy, which would be about a body condition score of about 5. It's going to depend. My colleague likes to see horses more at a 6, which is maybe a little bit overweight, and another one of my colleagues likes to see it at a 4. So, endurance horses are kept at a 4. Most polo horses are a 4. So it kind of does depend. Beauty really is in the eye of the beholder, I think, in a lot of these cases. But again, checking with your veterinarian is always good to see what he thinks your particular horse should be maintained at. Okay, now for our continued talk on prevention and management, we want to feed as much roughage as possible, and at least 1 to 1.5 kilograms per 100 kilogram of body weight. So really we want to make sure that their diet is at least 75% roughage, especially if they're prone to gastric ulcerations. So we can, you can weigh your horse or use a weight tape to get the weight of your horse, and then you want to feed at least 1 to 1.5 kilograms of forage per 100 kilograms of their body weight. And you can convert to pounds. There's 2.2 pounds in a kilogram. So, you can just do the math on that. And also, if we can give a high protein or high calcium forage, especially in the case of those horses that may be prone to ulceration, this may help to prevent them from getting it. So this may be a combination of alfalfa and grass hay, and I know that our friends out in California don't like to feed too much alfalfa because they feel that it leads to the horses getting enteroliths, or those intestinal stones. So, you would want to do what is right for your horse. So if you're afraid of alfalfa, maybe just making sure they have plenty of grass hay. So that's another way that you could deal with it. And then we want to avoid feeding sweet feeds as much as possible, especially for those horses that are prone to ulceration, that are at risk for ulceration, or that have already been found to have ulceration. So we want to feed less than 1 gram of starch per kilogram of body weight per meal, and less than 2 grams per kilogram of body weight per day. So again, we would figure out how much grain we should feed, and then we would want to keep our starch as low as we could and still meet the energy demands of the horse. So perhaps by supplementing with fat or something of that sort. If giving concentrates, we would want to feed them more frequently. I always tell my students never to feed horses more than 5 pounds at any one meal. So feeding more frequent meals is going to help to keep that stomach full with contents. We're going to feed hay always with our concentrates, and feed hay before our grain, because that's going to help to buffer the stomach. And then we can feed our concentrates, and we do want to feed more frequent meals rather than a large concentrate meal at once. And that will also help with preventing other diseases as well. And then providing pasture turnout whenever possible, or frequent forage. Let's face it, pasture turnout really can't hurt them. Although I guess they could get into a tiff with another horse or something. But providing pasture turnout really simulates the most what they, are used to, what they have evolved from. And even though our horses are domesticated, they really haven't changed all that much in their needs. So providing pasture turnout whenever possible, or frequent forage, feeding hay as much as you can, 4 to 6 meals a day, or having hay in front of them ad libitum, those would be the best for your horse. Oh, and then we have a person who asked us, would a high quality grass hay have a more buffering capacity than a low quality grass hay? And that's definitely true. A hay that has protein of 12 to 14% should theoretically have more buffering capacity than a low quality grass hay, protein of 6 to 8%. So for sure you could get your hay tested to see what the protein level was, and then try to feed as high a protein level. You don't want to go too crazy with protein because it secretes nitrogen and things into the environment. But if your horse is predisposed to ulcers, then feeding a higher protein hay would be better. Another thing that we spoke about was providing fresh, clean water continuously. Really, we should do this no matter what. And, I always talk to my students about what the most important nutrient is, and they think of a million things, but they never think of water. And, just a 12 to 15% loss of water can actually be fatal. So not feeding water it can be really bad for the horse. It's really needed for every metabolic activity that takes place in the body. And I guess I, kind of didn't think a lot about it either. My parents were always impressing on me when I worked at different stables, to make sure that I provided water. But one time I was working at the stable, and while I was away, no one watered the ram for about a week while I was off looking at colleges. And when I came back, the ram was dead, and he had gotten dehydrated and died. So that impressed on me the fact that, we take water for granted, but is really key. Someone has asked about research on hindgut ulcers. There is some research on that area. I myself am not a specialist in that area. Anthony Blickslager is a very good resource for that if you wanted to Google him. I could type his name in here right now for you to see. But he does a lot with colonic ulcers. Okay, there you go. And whenever possible, we want to avoid stressful situations with horses, especially those prone to ulceration. So long distance travel would be one. Changing environments, long periods of confinement where they're confined to a stall, and avoid leaving horses more than 6 hours without forage during transport. So if we are transporting them, stop at least less than every 6 hours and provide them with some forage and some water as well. So we do want to make sure that we do that. And we can also consider giving anti-ulcer medicine before transport, either if we have a horse that we think may be at risk for ulcers or one who already has had an ulcer. That might be good preventative medicine. Okay, and then we want to use the minimal effective dose for nonsteroidals, and we may want to treat simultaneously with an anti-ulcer medication. And then when we could talk a little bit about racehorses, prior to racing, they should be given their normal ration. We can give forage up to 3 hours prior to a heavy-duty workout or race. Then we don't want to feed hay or concentrates within 3 hours of their workout or race. And after, we can again offer forages, but not feed concentrates until at least 2 hours after exercise. And water can be offered free choice after exercise, but initially we should have them drink it slowly. So really, the best thing to think about with ulcers is trying to prevent them. And just giving medication alone is really not going to change whether a horse gets an ulcer or not. Like, you may treat that particular ulcer, but by not changing your management, it may be that the horse will get an ulcer again later after this one heals. So the key when a horse gets an ulcer is to look at your management and see how it may be that you're doing everything right. Some horses may be just more predisposed to ulcers than others. As I said, they're continuous gastric acid secretors. Some secrete more acid than others, so that can predispose them. So but do take a hard look at your management and say, is there anything I can do differently that will prevent this in the future? Because that can be a really important thing. So we know that gastric ulcers have many causes. It's very multifactorial. There's also a long list of potential risk factors that we've gone over here tonight. And it is important to evaluate the horse's diet and daily management to prevent them, because as I said, just the medical management alone isn't going to keep them from recurring. So by following these recommendations, it may be possible to prevent or reduce the risk of gastric ulceration. But feeding and management practices must change to prevent recurrence. And these are some resources that I have used tonight, which may be of help to you. And I know that we're going to be archiving this webcast. And I would just like to acknowledge my co-author, Nana Lutherson, who helped me write a recent chapter on gastric ulcers. Dr. Frank Andrews, who was my mentor and was on the Equine Gastric Ulcer Syndrome Council. And Richard Hepburn, who wrote a great article in March in Equine Practice on gastric ulcers. And then if anyone's local, I just wanted to mention some upcoming events at UConn. So that would include our trailer driving clinic, which is, oops, a little thing's freaking out here. It's 9 to 12 on Saturday, March 26th, and we have a natural horsemanship clinic that same day, 1 to 4. And spring clinic with Deb Moynihan on Sunday. And then we have our Sigma Alpha Open Horse Show coming up on April 3rd, and a horseplay lecture at UConn. Oh, here we go.
I think we're both clicking the arrows. You have to use the arrows at the bottom to get your
Oh, okay.
points.
Oh, you got it. Okay. Okay, and then we have our riding camp safety certification clinic on June 11th, and our summer riding program, which is open to the public. So if you do have any questions, then do feel free to email me, and I will try to answer you as much as I can. And one participant has asked me, how do I feel about free choice grass hay? I think it's an excellent idea, and I think it definitely will help buffer your stomach. Your horse's stomach. So I do say, that would be great if you can do free choice grass hay. Okay, thank you very much. You're going to receive a survey by email in about 1 to 2 days. So if you could take a few minutes to give us your feedback, it will help Michigan State University and the rest of us to better serve you. And there is an upcoming webcast on April 19th at 7 Eastern Daylight Time, Understanding and Evaluating the Gaited Horse. So thank you very much for attending. And let's see, a person has talked about a website that has omeprazole 700 milligram tablets, enteric coated, better price than paste. I think you should check with your veterinarian to see how he feels about that. So why don't you check with him about feeding those tablets. Okay, thanks everyone for attending. And I'll stay on to answer any questions for the next little bit here. Thank you very much.
Okay, thank you so much, Jenifer, for your presentation. And I want to thank all of you for participating. If you want to go ahead and continue to type questions in the chat box, that's okay. I just wanted to take a minute to say thanks and let you know that, again, this webcast was recorded and it will be uploaded to our website by the end of the week. And you can send us your comments and suggestions to info@myhorseuniversity.com. And you can also become our fan on Facebook or follow us on Twitter for more up-to-date information about upcoming events, special promotions, and more. And thanks again. Have a great night.